use your raise hand function. Olivia, if you send a request from the record button, I can approve it. Got it. Give everyone a couple more minutes to put their record requests through. Great, seeing no more record requests coming through. Oh, one more. A.G. Campbell, I'm going to turn it over to you for opening remarks.
Great, thank you. Good morning, everyone. I am absolutely proud to be here alongside my counterparts from Illinois and Michigan, respectfully, Attorneys General Kwame Raoul and Dana Nessel. Today, we are proud to co-lead a coalition of 22 attorneys general in filing a suit to stop yet another illegal action by the Trump administration. The federal government, through the National Institutes of Health, is the largest funder of biomedical research in the world. They provide more than $35 billion annually to support cutting-edge research that saves and extends lives, making the future better for our residents, especially our children and our elders. This work improves our ability to treat and cure diseases and to have an impact on all of us, no matter what political party you may support. Every research project includes the cost of specific research itself and also the cost of things that go along with it: the buildings, the infrastructure, the doctors, the scientists, the professors. Federal law refers to these core parts of medical research as indirect costs. On Friday night, the Trump administration announced it would be cutting funding for indirect costs effective today. This is an attempt to eliminate funding that supports medical and public health innovation at every research institution in the country. The administration's recent directive would abruptly cap indirect costs at 15%, significantly less than what is required to conduct advanced medical research. The administration knows that. In fact, Trump proposed these cuts in 2017, and the Republican-controlled Congress at the time passed a law demanding continued stable funding for medical research. That law is still in effect. Whether the president believes it or not, funding that covers lab costs, faculty, even graduate students is a critical part of the research process. They are the wheels that keep the trains on track. Without these indirect cost rates, that train grinds to a halt. You don't need to be a brain surgeon to understand that in order to conduct medical research, institutions need laboratories and clinical trials. They need specialized staff and technology support, just as any of our workplaces do, except at an even higher level because the medical research involved is cutting edge and world leading. The Trump administration said on Friday night that it would impose cuts to these supports the very next business day, giving institutions no time to plan for the enormous budget gaps they are now facing. As we speak, there are laws in place that prevent the president and his administration from damaging ongoing medical research throughout the country. The president cannot simply toss these laws aside and put public health and medical advancement at risk. So once again, Democratic AGs are taking action to hold the president accountable. We filed our lawsuit this morning in Massachusetts, the medical research capital of the country. We're home to world-leading universities and institutions that employ some of the brightest minds on earth. These institutions work tirelessly to save lives, create jobs, and create a better future for our children and our grandchildren. In fiscal year 2024, 219 Massachusetts institutions received approximately $3.5 billion in NIH funding to support nearly 6,000 medical research projects. Those projects included studying how we can improve healthy aging for people living with Alzheimer's disease and dementia. Projects identifying new therapies for the treatment of adult and pediatric cancer, ALS, Parkinson's disease, heart disease, PTSD, and projects advancing COVID-19 research early detection of brain aneurysms, and so much more. As AGs, we will not allow the Trump administration to play politics with our public health. We will not allow him to unlawfully undermine our economy or compromise our institutions' cutting edge work. Each of us has a loved one who has had cancer or faced cancer, addiction, infectious diseases, or any number of illnesses that NIH-funded research could support. We're not just here fighting for the rule of law, we're fighting for them. We're fighting for a healthier future for our kids, and I'm exceptionally proud to do this alongside 22 other states, or a total of 22 states, in collaboration with my AGs. It is now my pleasure to turn it over to the Michigan Attorney General, Dana Nessel.
Thank you, AG Campbell. I am so proud to join you and AG Raul in leading this effort. As you indicated, this funding supports life-saving research on all kinds of life-threatening public health diseases, viruses, conditions like cancer, bird flu, whatever might next be the next COVID. That research benefits all of us. And these dangerous proposed cuts are indiscriminate and without purpose. They will cut thousands of jobs here in Michigan. They'll disrupt tens of thousands of research projects here, many of which are already currently underway and focus on improving health outcomes and, of course, preventing deaths, unnecessary deaths. In Michigan, we have over $1.013 billion in NIH grants, 226 million of which would be immediately axed. We have so many great programs. Michigan State University's Miracle Center that allows for the healthy delivery of babies to mothers in 20 Michigan counties, to the Karmanos Center Institute, which partners with Wayne State University, providing cutting-edge clinical trials and patient care for 37% of those diagnosed with cancer in the region and across 50 countries, to Mott Hospital at the University of Michigan, which does experimental genetics trials, helping children who have brain cancer and various physical and mental disabilities. I mean, the list goes on, but the future of those programs and those services could no longer be guaranteed with these cuts. Now, I would remind President Trump and those who do his bidding, you are a president, not a king, and you cannot unilaterally, indiscriminately reformulate billions of dollars in critical grants already carefully negotiated by the federal government. I was going to say that while I feel confident that the courts will agree to our request for a temporary restraining order, good news, as of a few minutes ago, we already got a court order, which we believe will impact these very cuts that we're talking about right now. And I'm just going to quickly reference the order from the U.S. District Court in Rhode Island on the New York v. Trump and the Office of Management and Budget, who already in our request, our motion to enforce the court's order, specifically referenced the NIH. And so hopefully we believe that this actually is already a TRO as to this particular request that we're making. We'll have further clarification on that later. But I will say in addition that I implore moving forward that the Trump administration look for taxpayer savings using a scalpel instead of a sledgehammer. Time and again, in just the last 3 weeks, we've seen Trump and the federal government implement sweeping, indiscriminate cuts without rhyme or reason and with zero consideration for the consequences to the American people, with little to no notice for those that are receiving the programs or administering them.
Why is it not playing in my headphones?
This administration leaves behind a web of chaos and confusion for everyone, from Meals on Wheels recipients to Medicaid patients to essential emergency services for law enforcement, and now this, public health. These draconian, inexplicable edicts impact every single American. Literally, no one is spared. The federal government has an obligation to stop breaking their promises made to the American people, which is exactly what has happened here. And as attorneys general, we have an obligation, moral, legal, and ethical, to serve the best interests of our constituents. And we will continue to do so each and every time the policies of this administration and the federal government violate the law and inflict specific concrete harm or injury to our states or our state residents, as has happened here. Enough is enough. And with that, I will now turn it over to my colleague, Illinois Attorney General Kwame Raoul. And General Raoul, I just want to make sure the public at large knows Lake Michigan is still called Lake Michigan, irrespective of whatever your governor has said about it.
Well, thank you for that, AG Nessel. We'll have to have a fight about that. Thank you to AG Campbell and AG Nessel, to the both of you for your partnership. As indicated on Friday, NIH announced a new policy that would cap so-called indirect costs associated with academic research at 15%. This is an enormous and unprecedented shift. Announced with no warning and with immediate effect. NIH estimates that it would cut $4 billion out of university budgets annually. That is a huge blow to our university's ability to conduct life-saving medical research and achieve breakthrough discoveries that make life better for all of us. The impact of the change would be enormous in Illinois and to the country at large. It will cost the University of Illinois system alone roughly $67 million annually. It would also mean significant cuts to private universities and other public universities. The affected universities work on cutting-edge medical research that the public relies on would be hugely impacted. Southern Illinois University system, for example, has developed new treatments for cancer, Alzheimer's, Parkinson's, and diabetes. Just last year, NIH funding for University of Illinois research led to the development of an antibiotic to fight drug-resistant bacteria, an updated drug to treat the most common blood cancer in children, and a new screening method to help physicians detect ovarian tumors early. Without the funding from NIH, the capacity to conduct this type of research is significantly reduced. Medical researchers can't function without labs, equipment, proper safety protocols, high-speed data processing, and support staff. This change would force universities to cut back on critical medical research activities now and prevent students from gaining the skills necessary to become effective researchers in the future. Moreover, NIH's move is just simply illegal. The first Trump administration proposed similar cuts in 2017, but Congress specifically rejected the idea. Every appropriations bill since then has included a provision that explicitly prohibits HHS or NIH from using appropriated funds to alter this reimbursement system. And NIH's notice is essentially unreasonable. It does not address the enormous costs that the policy change will have on academic institutions. It applies not just to future grants, but also to existing grants with long-established negotiated rates that universities relied on when setting their budgets and planning future research activities. I'm very proud again to join my fellow attorneys general to fight back against these illegal cuts that put the future of life-saving medical research and America's role as a leading innovator at serious risk. And I think we will go to questions now.
Thank you, AG. If anyone in the room has any questions, please use the raise hand function and I will call on you one by one and ask you to unmute yourselves.
Just
And
before you call on whoever's going to ask questions, it looks like maybe Melissa's first. I'm not going to take that turn. I do want to just clarify, I'm really proud, of course, to be in partnership with AG Raoul and AG Nessel We just received this motion to enforce win out of the OMB case in Rhode Island, and it is significant. It points to the power of AGs coming together to push back against an administration that continues to take unlawful action. And while NIH funding is mentioned in that order, we still need time to review. We don't want to suggest that the breadth and scope of that order is the same as the relief we're seeking in this case we just filed this morning. It is not. This indirect cost issue is a significant one for institutions all across the country. We'll press forward with the lawsuit today, and really grateful to all of the states, all 22 Democratic AG states that have stepped up to file this lawsuit to push back against the administration on this indirect cost issue, and to continue to take action against an administration that takes, it seems like every day, unlawful action, and will continue to hopefully win to protect our constituents and our state economies. Thank you.
Thank you, AG. When I call on you, please unmute yourself, say your name and your outlet for the record, since we do have outlets from a variety of states on today. I'm going to start with Melissa Nanberg.
Hi, this is Melissa from the Detroit News. Thank you very much for doing this call. I had a two-part question. I just hoped you could clarify what the relief is that you are seeking. Is it an injunction or a temporary restraining order in your specific lawsuit that you guys are filing? And part two, specifically for AG Nessel, you mentioned, I think, $226 million would be immediately axed in Michigan. I'm assuming that is largely from grants held by or negotiated by University of Michigan, followed by MSU and Wayne State. But I was hoping you could just clarify that, who those the biggest universities that would be affected by this.
Sure. Thank you for that question. And I would say that you're right. Out of the over $1 billion in grants total, of the amount that would be immediately impacted, that's 181 million from the University of Michigan, and from Michigan State, 27 million, and from Wayne State, 18 million. And yes, we are seeking a TRO.
Thank you.
Thank you. Jonathan Wozen.
Thank you for taking our questions. I'm sure you guys have been very busy lately. Just two sort of timing logistical questions. When's your best sense of when you may get a ruling on granting a TRO, and is there going to be a hearing as part of this? Just curious about both of those things.
I can chime in. We just filed it, and we're still waiting for a judge to be assigned, hearing all of that. So we will keep you all abreast. And just to add to AG Nessel's point, and I think AG Raoul would agree, we're not only seeking, of course, a TRO and for the court to declare that this NIH rate change is unlawful and to stop it from taking effect, but we're doing it for plaintiff states only, advocating and fighting for the universities within our respective states. And we expect that private institutions will follow separately with respect to a lawsuit on their own.
Great. Does anyone else have any questions? Sure, I'm not missing anyone.
Sorry, I couldn't figure out how to raise my hand. This is Meg Terrell from CNN. Can you hear me?
We can.
Can you just clarify a little bit more about what you were just saying, AG Campbell, about who this pertains to? If this order is determined that this is an unlawful thing to do, you said it would only cover your 22 states?
That's right, Meg. We are seeking relief for plaintiff states only, which includes, of course, public institutions and that are affected in our respective states. We expect private institutions will file lawsuits separately to obtain some type of relief, and we're confident that will complement our efforts and that we will work hard to succeed in this effort. And I'll just add, we are still waiting on details. We obviously just filed, so we don't have the details in terms of the timeline, what judge this has been assigned to, but we will keep folks abreast as those details unfold.
And so if states aren't involved in your lawsuit, the cut would still potentially apply to them?
Yes, and I think one thing we would all stress, along with AG Nessel and AG Raoul, is that this coalition is Democratic AGs. That's not intentional, it's just the way it is. And for those states that are not covered in this lawsuit because they are not represented by one of us, they should ask their respective AG what they're doing to protect them. We're, as a coalition, fighting to protect our residents, our state economies, and to make sure that this unlawful rate change doesn't go into effect.
And I promise I'll stop. But was there an outreach to the Republican state AGs to join you?
Well, I only can represent, of course, Massachusetts. And sadly, what we will say is that there is a coalition of AGs that have been coming together every step of the way to fight back against a series of unlawful actions by the president, whether in birthright citizenship, everything having to do with the OMB memo and federal funding freeze, this NIH issue. We are always looking to collaborate and work across the aisle because we deeply understand these issues are not partisan. Doesn't matter what political party you are part of. This NIH funding, for example, affects everyone regardless of a political affiliation. But sadly, right now, the only ones that are stepping up are AGs and Democratic AGs, including, of course, my co-leads.
I'd like to,
Turning it over to my co-leads.
I just wanted to make the point, you know, I read an article yesterday about how Senator Britt from Alabama was deeply concerned, as she should be, because of the significant impact this is going to have on the University of Alabama that receives a good deal of money from NIH and does some really impactful work. But you have to be more than concerned, right? And whether you are an attorney general, who of course we are vested with the authority to sue the federal government on behalf of our state residents, or whether you are a member of Congress, member of the United States Senate, I feel like you have an obligation to your state residents. You represent your constituents from your state who elected you. You don't represent Donald Trump. And may I say, I don't think you're doing a very good job of representing your constituents if you're not going to stand up for the universities and the many recipients of these NIH funds that are absolutely critical economically, critical from a medical and public health perspective. And it's time for all of us together, whether we are Democrats or Republicans, to stand up and say enough is enough. This is not in the best interest of all Americans. And we need to be defiant and to push back. And that's what we've done as Democratic attorneys general. But of course, I hope that others will join us because this is equally bad for everyone in this country.
I'd like to echo that sentiment. You know, there are plenty of issues that we have historically worked on a bipartisan manner, whether they're consumer protection issues or antitrust issues and others. But over the last 3 weeks, there's been an absence of interest where there's true damage to red entities in red states as well. So this is impacting negatively universities in red states, same as funding the illegal funding freezes impacted infrastructure, funds for law enforcement, funds to go after child predators in red states and blue states. But it was just Democratic AGs who stepped up and who have stepped up consistently. And I'm concerned for those citizens in the red states. However, I don't have standing to represent them.
Thank you. Anjali from, it looks like Boston. Did I say your name correctly? I apologize.
Yep, it's Anjali with the Boston Globe. Thanks so much for doing this. I just wanted to see if you guys had a sense for whether this new 15% cap is more legally enforceable for new contracts versus older ones and how the lawsuit you filed today applies to that.
I'm happy to take. Okay. What we're saying is when we drafted these documents, we're of course looking at contracts that were already in place where universities and institutions negotiated these rates. And then some are in the process of still negotiating these rates. What we're making crystal clear is that the action taken by the president for several reasons is unlawful. And we want to obviously go into court to seek this temporary restraining order to stop it from taking effect, to protect our institutions in our respective states from significant harm.
Yeah, and I would remind you all that the 2017 action by Congress that AG Campbell referred to earlier, until Congress makes a different decision, it exists for current contracts and any actions under these appropriations going forward.
Plainly put, as AG Raoul said, the cap is unpermissible under existing law.
Okay, seeing no more hands, thank you all for your time today.
Still have one out there.
Who is it?
Peter Hancock with Capital News, Illinois.
I don't see your hand, Peter. Sorry about that. Go ahead.
Oh, sorry. I thought it was up there. One for Attorney General Raoul and anybody else who wants to jump in there. I mean, the president can issue 100 executive orders a day. Executive orders don't cost anything. He has unlimited ability to throw these things out. Your offices all do have limited resources. General Raoul, you're currently involved in litigation involving birthright citizenship, about the proposed spending freeze. Now this, and I'm losing track of how many others. I mean, at what point does he sap your resources? And, you know, at what point do you no longer have the ability to respond to every pitch that he throws in the dirt? Are your resources about to get stretched to the limit?
I appreciate your question, and if I were in this battle just individually, without the collaboration of my colleagues from the other 21 states that are involved in this action and other actions, our one team concept and our collaboration and our ability to communicate on a daily basis makes it and to work together and to divvy up responsibility makes it possible that we're in this fight for the long run on behalf of the American people. While I represent the citizens of the state of Illinois, I know the issues that the president has violated the Constitution concerning consistently, whether it's the 14th Amendment or the spending clause or separation of powers, impact more than the citizens of the state of Illinois. That's why I have been communicating and collaborating with my colleagues from other offices. One action that I'm uniquely situated in was because we're a defendant in the case is the DOJ lawsuit concerning our Trust Act, where also the County of Cook and the City of Chicago has been named in that suit, and we're prepared for that as well.
Okay, and then Lisa Roos Church with the last question for the day.
Yes, thank you. This is Lisa with MERS News in Lansing. I had that same question, but I wanted to direct it towards my governor or towards my Attorney General, Dana Nessel, please.
Yeah, hi, Lisa. Yeah, I mean, I would echo the sentiments of AG Raoul. You know, we're all working together. And so that does help a little bit in terms of alleviating some of the burdens on our respective offices. But that being the case, I mean, you know, multiple members of my staff worked all weekend long on this. And, you know, we really haven't had a break. And I think that that's true for all Democratic AG offices across the country. But again, I think we see the incredible seriousness of these times. And if you look, of course, at the actions that we've taken, I would say that any resources that we're expending are well worth the cost to save, you know, critical programming that states like Michigan absolutely cannot lose. And that includes, of course, these NIH grants. I mean, critically important to the state of Michigan in every way you can possibly imagine. So are we stretched a little thin? Yes. Would I rather dedicate those resources to double down on going after, people who prey on consumers and seniors, or going after environmental polluters or human traffickers? Yeah, that would be great. I wish I could do that. But unfortunately, day after day after day, we are seeing this continued assault on our democratic institutions, and we see a president who believes he's a king, and is trying to act like one, and who continues to act in a manner that defies federal law, defies the United States Constitution over and over and over again. And so we are willing to do whatever it takes to stand up to this creeping authoritarianism and to protect the residents of our respective states.
Thank you. And my apologies, Angus, we are out of time for today, but if you email any of our press offices, agpress@michigan.gov for Michigan. I'm not sure what it is for AGs Campbell and Raul, but I'm sure you guys are all familiar. We'll be happy to get you that answer. Thank you very much for your time today. Thank you, AGs. Appreciate you all. Have a great day.